Presidential Task Force, the Director General, West African Health Organization, Professor Stanley Okolo, distinguished ladies and gentlemen of the press, a very good afternoon, and our sincere apologies again. However, I welcome you to the national briefing by the Presidential Task Force on COVID-19 for Thursday, 28 May 2020. In almost all of our briefings and communications, the Presidential Task Force had made it the need for a drastic change in our lifestyle and behavior, as consequences of the COVID-19. This advisory is based on the fact that the battle is long-term and the cure is still in a distant future, nearest being end of 2021. We'll continue to urge our citizens to follow these advisories diligently. This point is further underscored by the statistics coming from other parts of the world. A look at the global numbers showed that the world has recorded about 5.8 million cases as of today and over 350,000 fatalities, and reporting from 251 different countries. Of particular note is the fact that a major nation reached the landmark of crossing beyond the 100,000 deaths in a system where the healthcare system is regarded as advanced. Similarly of note is the shift in the epicenter from Europe and the United States of America to South America, particularly Brazil. And of significance here is the Brazil case, which resides in terms of similarity between Africa and Southern America, weather-wise, and that calls for extreme caution on our part. The Presidential Task Force therefore wishes to underscore the need to press further in the development of our infrastructure, intensify our non-pharmaceutical response, the need for our citizens to comply more, and for our communities to get more involved. We say again, we cannot afford to be complacent, continue as if we are not under threat, doubt the virulent nature of COVID-19, and continue to allow the virus to ravage our communities because we are fully in the community phase of the spread of the virus. Yesterday, we informed you during the briefing that the Federal Minister of Health held a virtual conference with the traditional medicine practitioners of Nigeria. We also informed you that issues discussed covered intellectual property rights protection, need for non-disclosure agreements, and the funding opportunities for research and validation processes. Unfortunately, the information put out in the media regarding shortlisting 3 remedies from the traditional medicine practitioners is totally misleading. And I remember exactly what I said in paragraph 11 of that particular brief yesterday, where I mentioned the fact that out of the numerous claimants, 3 were found to deserve further investigation and have been forwarded to the relevant authorities for appropriate action. For the avoidance of doubt, neither the PTF nor the Federal Ministry of Health has shortlisted any remedies. This can only be done after diligent processes and as may be directed and advised by the relevant agencies. The Presidential Task Force has received rather sadly reports of continued refusal by medical institutions to receive and treat patients for fear of COVID-19. This has resulted in several unfortunate and unavoidable fatalities, and statistics have shown that there is a drastic drop in the percentage of attention being paid to other ailments not related to COVID-19. This situation is made worse by the fact that federal tertiary institutions have been mentioned among those rejecting patients for fear of COVID-19. This is not acceptable, and we are saddened by this development. The Minister of Health has reached out to all medical directors, directing them to continue providing regular medical services so that we do not end up with avoidable death. Truth be told, we are having more deaths from non-attendance to other diseases than COVID-19. The reason for the greater emphasis on COVID-19 is because it is a pandemic, and if not curtailed, has the capacity of wiping out a large segment of our population. The Presidential Task Force also urged all chief medical directors and private health service providers to attend to other health challenges which continue to confront our people on a daily basis. Of course, the guidelines for dealing with patients presenting COVID-19 like symptoms are available, and if these are applied by our medical service providers, there will be a lesser risk of exposure to the virus. Within the next 70 hours, the Presidential Task Force will conclude its assessment on the impact of the measures put in place, and further recommendations will be made or submitted to the President for a decision. While we take steps, the Presidential Task Force will continue to appeal to all Nigerians on the need for taking this fight with utmost diligence. It is for self, it is for your family, and it is for the whole community. On our part, we are sparing no effort in coordinating the national response, collaborating with all necessary stakeholders, and supporting subnational entities in their individual state responses, which we always maintain should be in synergy with the national response. Today, the Presidential Task Force expanded the scope of collaboration and experience sharing to the ECOWAS region. This is in keeping with the role of Mr. President as the ECOWAS COVID-19 champion. This interface through the West African Health Organization, WAHU, will be deepened as part of the short, medium, and long-term objectives for controlling the pandemic. The essence of this regional effort is underscored by the huge population of Nigeria and the trade activities across the borders. I now will call on the Honorable Minister of Health, the DG Nigerian Center for Disease Control, and the National Coordinator to provide further updates. And I want to thank you for listening.
Chair of the PTF, Honorable Ministers and heads of agencies, our guest, the Director General of the West African Health Organization, Professor Stanley Okolo, ladies and gentlemen, my briefing today begins with greetings and best wishes to our healthcare workers for their service and sacrifice, and the hope that we now substantially adhere to advisories on how to keep ourselves safe from random and nosocomial COVID-19 infection, so as not to continuously diminish available manpower for response. The work of healthcare workers begins with helping to drive risk communication and community engagement by joining the campaigns against crowding and for observance of hand hygiene, respiratory etiquette, and the use of face masks in public places. I started with this because health manpower and compliance with non-pharmaceutical measures will, with time, become the most important part of our strategy, and success will increasingly depend on a strong public-government partnership to make it work. In this respect, we shall also continue to engage our traditional, community, religious, and business leaders to mobilize support for citizen sensitization and mobilization. The core response strategy of the Federal Ministry of Health is still based on trace, test, isolate, and treat, which, as at this morning, has yielded 389 new single-day cases for a total of 8,733 confirmed cases of COVID-19 in the 34 states and Federal Capital Territory, of which 2,501 have been successfully treated and discharged. We have sadly recorded 254 deaths, most of them persons associated with other ailments, whereas most of those discharged had no comorbidities, confirming the general observation that risks are higher for those with illnesses such as hypertension, cardiovascular disease, diabetes, and other communicable and non-communicable diseases. 49,966 tests have been done so far, 1,422 in the last day on recording. It is too early for us to generalize about mortality trend or even rates of recoveries and discharge when compared to new cases. But it is time enough to advise that all persons who have or may be suspected to be hypertensive, diabetic, or have had kidney ailments or liver disease, cancer, HIV, TB, or even those who are 60 years and above are more vulnerable and need to better protect themselves or be protected. We also know that coronavirus infection has less serious effect on younger persons, except those persons have ailments mentioned above. The responsibility for protecting ourselves and each other is therefore with all of us. Hence, the urgency again for us to use masks outside our homes and for social distancing. It is especially important where we have gatherings, like when we have to go to the market. We are, not surprisingly, worried about the increasing number of COVID-19 confirmed cases. First, because every life matters, but also because the capacity of our health system to cope. Nigeria presently has well over 112 treatment and isolation centers in the 35 states and FCT with well over 5,000 beds, but not all states have made it up to at least 300 beds prescribed for isolation and treatment. I had the privilege of commissioning one such center, Ready Center, yesterday, a repurposed hospital in Benin City, Edo State, with 300 beds, including ICU, and also Edo State-owned PCR testing laboratory. We need to continue increasing bed capacity in all areas to match the probable number of patients so that we do not experience the horrific scenes of bed space shortages seen in some European hospitals. In event of overflow, we can require hotels, school dormitories, etc., to be prepared for level 1, which is quarantine, level 2, isolation, which is of COVID positive patients with 0 or mild symptoms, so as to free hospital spaces to be dedicated to level 3, moderate to severe, and level 4, high dependency and intensive care units. I therefore call on activists and philanthropists to work with state governments in concerted steps to scale up non-pharmaceutical measures and also beef up the infrastructural assets for isolation and treatment in their states. Though we are in a community transmission phase of response, easing social restrictions is desirable, but only if we can meet up with expectations that will not allow a spike in infection rates when changes are made. This is the ideal, and it is what has led in certain countries. In certain countries, such a spike has led to reintroduction of lockdowns. We in the health sector are reviewing health-specific advisories on reopening the economy further. Global efforts to find a cure for COVID-19, in which Nigeria is participating in the WHO Solidarity Trial, will be reviewed by our panel of experts as WHO suspended some aspects of the trial due to alarm raised by a medical journal on the safety of some drugs being tried, like hydroxychloroquine and chloroquine, or their combinations. Proposals for trial of local remedies for the disease have been sent to relevant research and testing agencies for scientific evaluation. The Madagascar herbs have been received at the Federal Ministry of Health and were found to consist of 2 varieties, one variety labeled to be for prevention and the other labeled as for treatment. Samples have been given to or are to be given to 3 agencies of the Ministry of Health and also to the Ministry of Science and Technology. These are all normal processes for new preparations to be approved for use in Nigeria and include toxicological and efficacy tests and clinical trials. Government will investigate all genuine efforts to find homegrown solutions to the pandemic. Preliminary reports from the ministerial scoping missions to Kano, Katsina, Borno, Sokoto, Cross River, Gombe allow cautious optimism, especially with regard to Kano and Borno, and also suggest that the support of experienced federal teams has a strong stabilizing effect on state efforts. Final reports are due soon. Such operational team will be going to Cross River State as soon as the details are worked out, while a mission to Kogi will follow suit next week, as has been discussed with His Excellency the Governor. Until a cure or vaccine is found, prevention and care are still the best approach to controlling community spread of the virus. We must strengthen the social measures that compensate for the risks to be expected if and when restrictions are further lifted. Thank you for your listening attention.
West Africa Health Organization, thank you for joining us today. Gentlemen of the press, good afternoon. As we continue in this phase of the lockdown and we prepare for businesses to start work, there's been a lot of pressure on testing. So we've got a lot of queries around rapid diagnostic test kits and on companies intending to test their entire workforce before people are allowed back into work. So I decided to use this opportunity today to talk a little bit about rapid diagnostic test kits. Now, nothing will excite us more if there was a validated kit available. But at the moment, we don't know of any. And very often we are asked, will it not be good to have a cheap test or a 15-minute test or a 20-minute test? And my standard answer to everyone is, before we can consider time and cost, the first consideration is, does it work or does it not work? If it doesn't work sufficiently, the considerations of time and money are misplaced. Recent data out of the US showed that a certain kit that was invested in was right 50% of the time. So you can imagine if a test kit that you're using to say whether you have a disease or not is correct 50% of the time. So it means it's very hard for any physician to make a valid conclusion on those test kits as we know them at the moment. So we'll keep working on this. In the meantime, we're relying on our PCR testing capacity, which we continue to build up. Like the Honorable Minister said, he just opened a lab in Edo State yesterday. We have pending requests from His Excellency Governor Mohammed Abubakar in Jigawa State and Governor Kaede Fayemi in Ekiti State, both who have invested in new labs for their states that we're preparing to come and see if they're okay and open and activate. This is at the same time while we are planning probably what will be the biggest transformation of laboratory medicine in Nigeria by the end of this outbreak. If there will be one legacy that will come out of this outbreak, it will be the state of laboratory practice. So if I was a medical laboratory scientist, I would be honing up my molecular diagnostic skill sets, because you will be expected, there will be a lot of demand for those skills across the country as we focus on building up this capacity across the country. Our immediate target is one lab per state, but those that are following carefully will see that certain states already have much more than one lab. The lab in Edo State, where the Honorable Minister opened yesterday, is the third molecular diagnostic lab in Edo State. So if I were any state government, I would be pushing hard in this direction, working with the federal government, pulling resources to maximize the opportunity that this crisis presents. In addition, so far we've trained 880 people, professionals, on sample collection, packaging, and transportation. One of the biggest challenges we've had in testing is that the samples get into the lab are so badly packaged and often have leaked out completely or come without forms that they eventually make a wasted effort. So we've been working very hard to train people across the country. Yesterday, COVID finally put in 47 million naira into sample transportation. So the private sector is coming on as well. COVID, as you know, is a collection of corporate Nigeria, and they've put in funding going directly into the private courier firm that is supporting sample transportation across the country. So everybody is now coming together to make this system work. In Lagos, we're currently rehabilitating the Central Public Health Laboratory, which was really the beginning of public health laboratory services in the country, bringing it up to speed, and we hope that that alone will add a capacity for 1,000 tests per day into the public health laboratory system. So we're working very hard to increase the PCR capacity while hoping that in the meantime, we will have an easier test method. Dr. Okolo here, who's the DG of WAHO has supported us extensively and continues to in providing reagents for testing. So have Africa CDC, so have the Jack Ma Foundation, the UN family, and everybody really come together to support the escalation of testing, but we have to use the methods that work. There are various organizations selling what they call antibody tests. It's important to understand what an antibody test is. When an antibody test works, it only tells you if you have been exposed and infected. It doesn't tell you if you have an active infection or not. Therefore, on its own, it's very difficult to use to make a clinical decision. So I will really encourage everyone as we begin to plan to go back to work, whether you're an employee or an employer, to really focus on prevention. Testing your workforce with the methods that we have available will only tell you if that individual has the virus at this point in time. It doesn't tell you if he's had it before or if he will have it in the future. So what you end up with, even if he was positive, is yes, he's infected now. But if it was negative, it gives you a false sense of security around his susceptibility to future infections. So it's important that as we open our industries, as we open our services, we really think about the measures that we've continued to advise everyone to carry out and leave testing for the purpose for which it is there. There's a growing black market on rapid diagnostic test kits in Nigeria. We have to be careful in what we buy and how we use it and how we interpret the results that it provides. So on Friday, the Medical Laboratory Science Council of Nigeria will be holding a press conference at 11 a.m. They will have some announcements around RDTs. They will also have an announcement around the work we're doing together to enable private sector labs take on their responsibility on testing and supporting the work that we do. So I invite all of you here to join that press conference tomorrow that will be called by the Medical Laboratory Science Council of Nigeria. And for us, in the next couple of weeks, we are going to really push every state to increase their testing, increase their collection, and we really ask everyone to support us on this. The labs are ready, they have reagents, the entire infrastructure is ready. We now need physicians, public health practitioners, states, and people, citizens. If you're sick and you feel you meet the case definition, please have the confidence to approach the public health infrastructure to find out if you have this disease or not. Only through doing that will we be able to manage you successfully and prevent further transmission. Thank you.
Gentlemen of the press, good evening. So today I'll be talking about a strategy that the PTF will be putting in place over the coming weeks. This fits in with our move towards ensuring greater community mobilization. And this strategy involves an aggressive campaign to ensure that everyone in the community is armed with the information they need to stop the spread of COVID-19 and to protect themselves. It will empower communities to self-mobilize within their interest groups and collectively practice and enforce prevention measures. We will be involving communities across all 774 local governments in the country. It's a campaign for everyone, the young, the old, male, female, those with disabilities, everyone. But how will it work? The PTF will be engaging partners across the various states using existing assets, existing community engagement structures that we already have to disseminate COVID-19 messages right down to the grassroots. These partners include the National Orientation Agency, the Nigeria Red Cross Society, UNICEF, the National Council of Women Societies, Jamaatul Nasrul Islam, Yaradua Foundation, Nigeria Interfaith Action Association, the UN system, and many more. Our community engagement partners have a combined total of over 800,000 volunteers across the country that are ready to canvass Nigeria with life-saving messages. We will be leveraging on these established structures, these assets that already exist, that were used in the past to identify, treat, and control communicable diseases such as polio, HIV, and TB. But this time around, we are partnering to share COVID-19 messages. The volunteers that will be involved are all Nigerians. They live amongst us in our rural communities, in our urban areas. They have been trained to engage and educate community members in their local languages and dialects. You already know them. These are the youth corpers in your town, the midwives in your villages, the representatives of your women groups, youth groups, the disabled. And they are groups that are already committed in delivering healthcare interventions across their communities and stopping community transmission, even in far-flung places and at-risk locations. Our overall goal is to ensure that everyone has the information they need to protect themselves. So please welcome the thousands of committed volunteers who will be risking their lives for the greater good of Nigeria. They will be there to educate us. They will be there to provide us with the information we need so that we can change our basic behavior and stop the spread of COVID-19. So let us please listen to them. Read the educational materials they will be distributing. We can all be part of this solution by taking more responsibility and enforcing safety precautions within our communities and our homes. Therefore, I'm calling on the general public to please cooperate with these volunteers and to also take action on our own. So, for instance, if we see people gathering, let us urge them to disperse. If you see family members not obeying advisories, let us try and correct their behavior. If someone isn't wearing a mask, it's part of our responsibility to advise them appropriately. The federal government will continue to create an enabling environment to contain the spread of the COVID-19 virus. But again, we cannot really be everywhere. The PTF cannot be everywhere, nor can it do it alone. We just have to work with each other to make sure we push the message. Finally, in terms of appreciation, the PTF would like to appreciate the coordination effort of the African Union through the Africa Center for Disease Control and Prevention, otherwise called Africa CDC. Their contribution led to the smooth distribution of the JACMA donations recently. This donation and other support to African countries has been made possible because of several partnership initiatives cultivated under the Africa CDC-led Joint Continental Strategy for COVID-19. The strategy has also guided Africa's response and has helped Africa to make tremendous progress in fighting the pandemic. I would also like to thank the West Africa Health Organization for supporting the country and also for supporting Mr. President in his important role as the champion of COVID-19 in the West Africa sub-region. Thank you.
PTF COVID-19, the DG of the West African Health Organization, ladies and gentlemen of the media. Just want to give a quick rundown of what the ministry has been doing in the recent times in respect of sensitizing Nigerians against COVID-19. The ministry so far has produced video and radio jingles in the following areas. 1, general information on COVID-19, use of face masks, burial protocols, testimonials by COVID-19 survivors, mass gatherings, among others. All the jingles in English have been translated and produced in Pidgin, Igbo, Hausa, and Yoruba. So far, the ministry has developed 25 TV jingles and 25 radio jingles. The jingles produced by the ministry are currently running on 10 television channels. TVC in between the program, Your Views, between 9 a.m. and 10 a.m. Inside the 7 p.m. news, also AIT before the 8 p.m. news. On TV, prime time, Nollywood movies, telenovela, correct movies, Z World, Mbati, Star Times, Insimi Video, Star Times, Dadinkowa, Star Times, and Star Times Guide. Liberty TV, both Hausa and English channels. The jingles are also running on 40 radio stations across the country, with states like Kano, Kaduna, Lagos, Port Harcourt, Abuja having more than one radio station airing the jingles. In addition, we also have support from 40 community and campus radio stations across the country awaiting our jingles. We have also provided airing for the NCDC and its partners to broadcast the jingles they have produced on messaging for the physically challenged, deaf and dumb, and the use of face masks on all the channels. Similarly, radio jingles on various thematic areas in the fight against COVID-19 produced by the NCDC and its partners in Hausa, Igbo, Yoruba, Kanuri, Fulani, Nupe, Gbagi, Tiv, Ibibio, Igala are being aired on radio stations in the states where the languages are spoken. We also broadcast various creative developed by the PTF on the Ramadan and the observance of the Eid, lockdown protocols, asymptomatic COVID patients on radio stations, and the social media handles of the ministry. The revised ease of lockdown protocol by the PTF was published by the ministry in 6 national dailies across the geopolitical zones: The Sun, The Nation, People's Daily, Tribune, Leadership, and Vanguard. Our aggressive and sustained campaign on the social media has gained traction. In the last 5 days alone, some of the videos we posted have been viewed over 1,068,650 times. Thank you very much.
We are going to be looking into that. There are certain various agreements that doctors have in their training period, and the agreements usually are connected with a time period by which you must have reached certain milestones, and if you didn't reach the milestones, then you exit. And we have information about that, but again, we are in a serious period of emergency where we need to apply different rules, perhaps not modify existing rules. So we are looking into that to find out how we can modify the situation and make the best use of all doctors and personnel that we have at hand. We already have asked a few questions about that, and shall be talking with the authorities at Jos University Teaching Hospital, and also talking with the doctors concerned so as to see how to remediate it. Now, with regard to the laboratory, you also, I think that was from, you also partially answered your question that not all the laboratories are owned by NCDC. Some are state-owned, others are owned by private entities. So there are some states that own their own laboratories. What we do is create a uniform framework, laboratory network, by which all labs relate to each other and use the same criteria and same principles, and also report to each other. Even before this COVID came up, the Director General of NCDC and I, we had been talking about how to create a laboratory network interconnecting for efficiency, sharing experiences and best practices. So this is another opportunity, of course. The COVID outbreak is a good opportunity to drive that further. There are a few states that, as I said, have their lab and work together with NCDC. And in the case of the Edo laboratory set up by the state government, they are working closely with IRWA. And sometimes you do some validation among each other. Now, the third question was actually directed to the Secretary to the Government Federation, Chair of PTF. That's about the Madagascar drugs. I think Juliana may have stepped out at that moment. But the answer is that the herbs have been transferred to the Ministry of Health, and the Ministry of Health has identified the NAFDAC, which has collected samples, and then NIPRID, which is going to collect samples, and the Nigeria Institute for Medical Research in Lagos, which will also receive samples. And we're going to send samples to the Ministry of Science and Technology. We have written them to expect samples because they also have agencies that conduct research on phytomedicines, so that across the board, we will have done what the President himself had directed, that the herbs be evaluated scientifically. So we are going to have this evaluation done across the board so that we can get the best result out of it and know what the value is before they are given to Nigerians. Thank you. I think that's all. Yes? Yes. Yeah, the question. No, let me answer your question. The point is that anybody can use anything, but the question is this recognized for the purpose that we are looking for? The purpose is a diagnostic purpose, and the standard testing for diagnostic, for recognizing whether a person has a COVID-19 infection or not, is a PCR test. So you can do a rapid diagnosis. Some people have done it, they do it, but it is not recognized for the diagnosis. I think that's your question. The validation principles, which are coming from NAFDAC and I think medical laboratory science, I think the NCDC will speak to that one. But it is not what we use for diagnostics.
we have to tone it down a notch or two. There were a series of questions on Kogi. My Honorable Minister was in touch with His Excellency over the last couple of days. I think everybody is working very hard to resolve this issue. There's actually no dilemma in the two cases. They followed absolutely normal practice. This were a patient that was referred from the Federal Medical Center to the National Hospital. This is a normal referral pathway when you have a case. The physicians in the National Hospital, I don't have any influence over the work that they do. They suspected COVID-19 based on the clinical symptoms of the patient. Asked for a test. The test came out positive. The individual lives in Kogi State. Everybody's in what we do in public health. Your public health response is based on where you live, because that's where your contacts are. So this is not controversial in any way. Standard practice was followed. Once the results came out, the state epidemiologist was informed that he has to do contact tracing around this patient. It is the state's responsibility to do that contact tracing. So we hope they do it. There's nothing actually controversial in any way about this. It's all standard, fairly standard practice. I think Friday asked whether we want to subject our test for validation. We're a public service organization. Everything we do is open to the Nigerian people. The last time there was some question about the test of the patient from Benue, we were asked to send it to NIMA. We sent it to NIMA. They got exactly the same result as we got. So there's nothing we hide about the work we do. We're there to serve Nigeria, and we do that to the best of our ability every day of the week. Yes, we probably promised to publish the high incidence local government. We will do so. We have the data available actually, so we'll do so by this evening. And I think Sani will talk a little bit about how that will guide our policy and our actions in the next few days. On the private sector labs, that's the press conference that the Medical Laboratory Science Council of Nigeria will be offering tomorrow. So once they do this, they will explain the process to invite private sector labs to join the testing family. On guidelines, there was a question around guidelines for sectors. I think I answered this question yesterday in terms of what sectors that we are responding to, supporting, and making guidelines. So we shouldn't repeat questions we were asked previously. So, no, that question was it directed at me? So, okay, can you repeat the question? Yeah, to be honest, right, people living with disabilities is a very broad community. So we'd rather address it within the specific sectors and within the remits of those specific disabilities. So it's very difficult to make guidelines for populations like that. They're all citizens, and they'll be considered. So when we do the aviation guidelines, they'll be considered in those guidelines because there are specific issues around them. I think we all take them very seriously. I think Amaka asked about models. We're continuing. It's very, even countries that work on modeling to assess where the peak is. Ultimately, there are models, right? You keep testing and you keep, if we had followed the peak of when the US outbreak was thought to have, estimated to have peaked, this was actually weeks ago. But the more you test, the more you have cases. So models help you define your response. But ultimately, what will help us define our response the most is the positivity rate in the testing that we're doing, which is why we're going to focus very aggressively with all your support on getting the samples in to be tested, right? And that's my charge for everyone now. Our laboratories are gearing to go. The individuals are gearing to go. We have reagents. They have been supported to work shifts. So really the challenge for us now is to collect the samples, get them into the lab, and make sure that we know where we are with the epidemic. And the question on the outlook with new findings, I think Dr. Ali will go into that because that's really what his group is working on in terms of defining the response over the next week. So thank you very much.
You see, this was the question about disability. So there are actually guidelines produced by the UN Human Rights Community on Disability. But disability alone may not be related to a higher risk of COVID or the severity of the illness. But nevertheless, people who are disabled may have more difficulty accessing care. They may also have more difficulty accessing information on how they can protect themselves. And we acknowledge this. We also acknowledge the rights of people with disability. And I'm sure appropriate guidance at the national level will be made available. In terms of the question about what do we do with those high-risk local governments, so moving forward, our key strategy for areas that are of high prevalence is definitely to look at greater community engagement and risk mobilization within these communities. So we'll be engaging in very high-level public awareness campaigns in these areas. We'll also be pushing for increased testing, expansion of testing, and making testing more accessible and available within the local governments. In addition to this, we have a proposal that is currently going through the Single Basket Fund towards setting up community isolation centers that will be around these local government areas. And we'll also be exploring the possibility of locking down the areas with high incidence, what we call precision lockdowns. But this has to be linked in with the provision of palliatives. It's much easier to lock down a small part of the country than to try locking down states or whole regions. So that's our strategy moving forward, but we're still working on it, and I'm sure at some stage we hope to implement aspects of it. The other question has to do with the NYC streams. What's going to happen? Well, we are in a challenging situation, as you all know. The schools themselves are closed. A lot of shops remain closed. Economic activity is reduced. This is a pandemic of immense proportion. It's a challenge that we've never seen in our lives, and we hope we will never see again. So the NYC scheme, as with any other scheme, will have to abide by the rules, the safety guidance that we have given with regards to stopping the transmission of COVID. So at the moment, I'm sure the NYC service itself will be looking at ways of mitigating risk when and if they open again to newcomers. But that's all I can say for the moment. Thank you.
To when the ventilators promised by President Trump will arrive. To the best of my knowledge, they have not arrived. When they do arrive, it will be made public. While I'm here, I want to also use the opportunity to please apologize to our brothers and sisters living with a disability. I've been reliably informed that we do not use the word deaf and dumb. We are deaf, and because those who are dumb also with good, speech therapists can also be able to recover their power of speech. So actually, what I meant was deaf. Thank you very much.
The National Open University and their publication. I think those who may have been on that site may notice that that wasn't a categorical date fixed. All our 84 study centers around the country are closed. What we are trying to do with the Open University is test for Zoom. Those, if there are students who are willing to take the exams on Zoom, we've allowed that. But there won't be any converging anywhere until the place is open, until the country is open. And until then, any exams that can be taken will be taken on a Zoom platform for those who want to go with it. I've actually spoken with the Vice Chancellor, Professor Abdallah, and Adamu, and he has confirmed that this is still the position as at today. Thank you very much.
Gentlemen of the press, and thank you so much for your kind words. I was asked some questions, but just before I talk about the questions, let me first of all say that we at WAHO are extremely encouraged by the sterling efforts of the Presidential Task Force, the NCDC, Ministry of Health, and all the ministries that are involved in combating COVID-19. What you're doing is really what we expect. We at WAHO, 2 weeks after this incident was declared a public health emergency of international concern, convened a meeting of all the ministers in Bamako to agree a regional approach. As at now, we have about 3 different approaches. But that's fine, because it is not a problem. The fact is that people move at their own pace. We have countries, 2 of our countries that are doing massive testing. We have 6 of our countries that are doing testing of suspected cases and contacts, and then targeted tests in terms of if somebody is ill, comes to hospital, they target them. People have disability, have a vulnerability and comorbidity, they also target them. And then we have the rest of the countries who are still only testing suspected and contacts. We have only 1 of our countries now that is still having sporadic cases. We have 2 countries that are having clusters, and then the rest of the countries are having community transmission. And therefore, we are in this together, and we really have to see how we flatten the curve. So let me just take some of the questions. And the importance of saying this is for us to know that we are not an island. We are trying as much as possible to have a regional coordination, collaboration, and communication, but we work with partners. And so in answering the question on cure and vaccines, we are working in a global situation where we're working with Africa CDC, with WHO. WHO remains the quality standard. WHO says the guidelines, it's a global body, it's a United Nations body, everybody subscribes to it. And so we are very happy that all our countries, 15 countries of West Africa, participate in the solidarity trials. And you know what the solidarity trials are, because we need to have different, I think there are about 4 or 5 different trials going on there. So that's what we're very happy to do, that we contribute to that and that we promote that. Because I'm answering that question, then let me also answer the question regarding the CVO, the COVID organics from Malagasy, because we have been criticized to some degree because we responded as WAHO and ECOWAS to a report that we had endorsed and then imported COVID-19 to ECOWAS. So we were only responding to that to say, number 1, we have not endorsed it, and number 2, we have not imported it. Of course, the right news then came out that it was an offer from Malagasy to different countries in West Africa. We believe in moving from science to the publicity. And the problem we had was that we had not at that time seen the science, but we are absolutely clear that there are 2 things that we need to do in terms of the science. The first is, what do the ingredients contain? And then the second is the clinical trials. What do they do? And I am aware that I was just speaking to the director of NAFDAC at the moment, who were in a meeting earlier today, and I know that they have done, or they are doing the work in terms of what does the ingredient contain. And that is also what we are doing across West Africa in some of our traditional medicine centers. I'm sure you do know that we support and promote traditional medicine. We have about 4 or 5 centers of excellence we work with. We have published a pharmacopoeia, which is a book of what traditional medicine, plant medicines do. That is in its 2nd edition. And how did we do that? We brought pharmacists and pharmacognostics together with traditional medicine people. Traditional medicine says this plant does this. Then the pharmacy universities will go and test it and see what it contains. And we've done that. So we support that. What we are now doing is that we are, at the moment, collaborating with WHO that is also looking at a protocol, and we are going to support some people who would want to do clinical trials in terms of some of the plant medicines that are claimed to have either cure or supportive effects. Fatality. Why do we have less fatality? I think maybe there are about 3 answers to that. Number one is that we don't know because the science of this is still evolving. Number 2 is that maybe we are not really doing a lot of postmortems and therefore determining why people die off. But number 3 is that if you look at demography, we have a demography that about 60% of our population are under the age of 30, 35. And from the data we are receiving, we have across the countries from 0.5% case fatality to 9.8% in a particular country. The average across ECOWAS is 2.1%. Nigeria is about 3%, I think. But we know that when you look at those under the age of 30, it's only 11% of them that die from this. And when you look at those over the age of 50, it's about 70%. When you look at people who have comorbidity, it's about 90%. And this is in our region. I'm not talking about what happens outside. And then when you look at what happens in Europe, you find that there are a lot of deaths in nursing homes, where you have a lot of older people. So that in itself may be contributing to that. And then the last question is really a question of what are our challenges. Our challenges are huge. I've already mentioned the issue of, we sometimes thought of a regional approach, but we don't have that. That's fine. The heads of states themselves also have now agreed that they set up 3 ministerial committees, the one on health, one on transport, and one on finance. And that is why, part of the reason why I'm here, because they also appointed His Excellency President Muhammadu Buhari as the ECOWAS champion, and these ministerial committees will support him. So we have issues in terms of cross-border. The borders are closed, but we are looking at how do we improve and how do we open up our economy. And as we do that, it's not just opening up the economy within each country, it's opening up the economy in the region. And therefore, we have to look at what we do with testing and surveillance, because I don't think any country would have done a lot of effort to cut down and bring down the cases in their country and then expect you to start having importation from another country. In fact, one of our countries is experiencing that already. In the northern part of one country, all the cases that they have seen were people who came from one of our countries in the region. We have the problem of the supply chain. And that's one of the things we're trying to do to try and burst this disruption in the supply chain. WAHO has been extremely active, and we have been successful to some degree, thanks to some of our partners, United Nations Development Program, UNDP, GIZ, and the Jack Ma Foundation. And so we are looking at how we help countries to procure materials. We also have the issue of humanitarian corridor. So we know that during Ebola, there were 3 countries, we could take rapid response team from one country to another. Now everybody is consuming its own smoke because it affects all the countries, but there are some countries that are weaker than others, and we would like to send people to them, or even send materials. That is an issue for us. And then the final thing is data, modeling. Chikwe has mentioned the issue of how the modeling might help you plan. But really, we do need that. And it is vitally important, because part of the issue why it's a challenge is because there are so many unknowns that go into a modeling. When you model in the Western world, you can determine the number of people you think will have the case. You can model for family homes. We can't do that here. And that is one of the things that we, therefore, as we model, we know there are a lot of caveats to it. But those are our challenges, and I thank you again for inviting me, and thank you, Chair. Thank you, gentlemen of the press. Thank you.
Basically, I don't have any other question to answer. Madagascar has been taken care of by the Minister of Health. Heavy burden local governments, the DG Center for Disease Control is going to provide those details. I think there are about 11 local governments now who constitute over 50% of the rate of infections that we have. The last one is, has to deal with what happens to the stream of NYSC. Well, I think even at the beginning of the outbreak of the pandemic, there was a set of NYSC that went into camp that were disbanded. I think the NYSC management is quite sensible enough to do what they did then, and I think they will continue to consider all the options that are available to them and take the appropriate decisions. But I don't think they will want to bring people from different parts of the country and get them congregated in one location at this very moment. As much as we want them to finish their NYSC and go off to start their lives, that might have to be delayed a little bit for their own personal safety and also benefit. But I think today I want to drive home a point that I've made severally, looking at the global picture of what we are dealing with as we come virtually to the end of the 2 weeks extension of the ease of the lockdown, to remind us that as of 30th of January, when the World Health Organization declared COVID-19 a pandemic, there were just 7,818 infections globally. Out of that number, 7,736 was in China. The remaining 82 were in 18 countries of the world. Nigeria didn't even have a record. Our first index case was on the 27th of February. From that, globally today, we are 5.8 million, with over 356,722 fatalities, and spread over 251 countries and territories. I just want to create a picture of the monstrous nature of the virus we are dealing with. From January to 28th of May, look at the exponential number, staggering number. And yesterday, one of the big democracies and economies recorded over 100,000 fatalities. And I think going forward as a people and as a country, and that was why in my remarks today, I created the significance of this drift and compared us with Brazil, which has now become the epicenter in Southern America, that shares almost the same climatic environment with the continent of Africa. Oftentimes you hear people say that this pandemic will not thrive in tropical Africa. But the similarities we share with countries like Brazil should give us a serious cause for concern as to our response as a people and as individuals. We are still not out of danger, and we should not deceive ourselves. We've not peaked yet. So there are more difficult days ahead. As government considers a balance between lives and livelihood, we will be informed by data, we will be informed by science, and in taking into consideration the plight of the people of Nigeria, government has a responsibility which is primarily vested in government to provide for the security and the well-being of the citizens, to take decisions that will further protect these citizens. So I want to make this appeal that as we get to the end of the ease of the lockdown, the extension, we must be mindful of the steps that we are going to take. And those steps, the final objective must to ensure that the certain bracket of individuals that we want to protect, the 20% that are likely to be extremely sick if they get infected, out of which 5% might likely die, are secured as much as we can and protected. And we have a collective responsibilities, those of us on this side of the aisle and those of you that are on the other side of the aisle, to continue to drive home this information, that our people should really take personal responsibility. They should not casualize the advisories that have been given by the health experts. The wearing of masks, keeping social distancing, maintaining personal hygiene, avoid unnecessary travels. If it is not important, don't congregate with more than a certain number of people. And do what you need to do to keep safe and be well. Like Jagma rightly said, that for any businessman that is thinking about dreams and plans for 2020 is wasting his time. The only thing that should be of utmost importance to you is to ensure that you survive 2020 by the grace of God. If you do that, you would have achieved so much. Thank you, and have a good evening.
Today's national briefing. And numbers have played a very important role in today's briefing. That also falls within the message that is coming out. Nigeria's population is about 2.5% of global numbers. It's 7th in the world and largest in our sub-region, certainly. We are in a community transmission phase to which we must respond effectively. We must change our behavior and build community cohesion. Let us take care, take the virus seriously, observe the guidelines and advisories as well, take responsibility, focus on prevention, wear your masks, create the awareness. God bless Nigeria. We hope to see you on Monday when the next briefing will take place, by the grace of God. There will be